Hi, everyone. Let me share my slides. Thank you so much for that kind introduction. I really appreciate being here today. In particular, I would like to thank the Housing for Health Conference Planning Committee for inviting me today. So can someone please confirm that you can see my slides?
Yes, we can.
Great, thank you so much. So thank you so much. My name is Nadha Hassen, and today I'm going to be speaking about improving social connections in our communities through the built environment. I'm also really looking forward to hearing from others, specifically from my panelists as well, and learning from all of you, because I think we really do have a lot to learn from each other. So first, I'd like to acknowledge the traditional Indigenous territory where I currently live in Toronto, known as Takaronto, that has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis, and is now home to many Indigenous peoples. I want to acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. And this particular territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. I feel it's especially important to acknowledge the land, given the topic of this conference today. And personally, as an immigrant and a settler to this land, I'm grateful for the opportunity to be and live here. I am unlearning the false history that I was personally taught and becoming more mindful and aware of the responsibility to engage in meaningful reconciliation. So this presentation has three main sections. First, I'd like for us to lay the foundation by defining terms and concepts so that we're really all on the same page here. Second, we're going to delve into the research and evidence which will frame our actions. And third, I'll share just some examples of interventions at three different scales. And finally, I'm going to end with some key takeaways and talk about some of the principles and considerations that we should all be thinking of. I know we have a range of professionals in the audience today, and it's been wonderful to hear from so many different people, from policymakers and public health professionals, to developers, architects, and others. And so this presentation, I'm really hoping to cover both research and practice. And so hopefully there will be something to take away for everyone. So let's begin by defining some of these concepts. So we're here to talk about social connections, but I'd like everyone to take a moment and reflect on what you think of when you hear the term social connection. Is it togetherness, a sense of belonging, community, support? Maybe it's even happiness. And while it turns out that social connection or social connectedness is really a pretty broad and complex concept, and we're increasingly realizing just how important it is and that we want more of it. But people in different parts of the world and from different disciplines define social connection in different ways. So here are some of the related terms that come up in the literature. And it can be defined in the positive, so in terms of what we're striving towards or for, like social capital, social inclusion, cohesion, support, and interaction. But it can also be defined in the negative as a lack of social connection. And so two of the most common ones that come up are social exclusion and social isolation. And one of the major challenges and problems with this is really that social connectedness and the equivalent terms are often used without definitions or interchangeably. And so then it's difficult to identify what exactly certain groups are talking about or what we're working towards. And more importantly, it's difficult to then track it. So Dr. Teresa Tam's 2017 report called Designing Healthy Living states that social connections within a neighborhood are formed by interaction with people and community involvement. And another definition by Plan H is that social connectedness is the frequency of contact with others, personal relationships, and engagement in the community. And so here we can start to see that there are very similar ideas that arise already. Something I do want to point out is that some of these terms focus more on individual attributes and relationships, like the term social supports, whereas others, like social capital, is more a feature of the social structure and tries to get at the collective, broader aspect. So it's more an ecological characteristic. And so for this presentation, I've included research and evidence across all these areas. And social connection is a bit of a catch-all for both these individual and group characteristics. So this report states that neighborhoods can affect social interactions by increasing the probability of meeting others and providing places together. And we've heard today already about how some of this is happening in our different cities and communities. But in addition, neighborhoods that are linked to higher levels of neighborliness, social capital, or a sense of community have very specific attributes that can be implemented through the built form and design. And so it's notable that during this COVID-19 pandemic, with lockdowns and with physical distancing, many people are realizing that their social connections in place or locally are fractured or even non-existent. And this is leading to even greater social isolation. So a team at the British Columbia Centre for Disease Control, including Sharito Galing, who is one of our panelists today, published the Healthy Built Environments Linkages Toolkit. And they used the term social well-being to encapsulate many of the different terms that I just mentioned. And they state that a growing body of research has shown that our sense of belonging or connectedness has tremendous impacts on physical and mental health. And so social connection can be considered a health outcome that is influenced by the built and natural environments. And that's important because then we know it's important to measure, track, and work towards improving social connections across populations, neighborhoods, and cities. So then how do we measure social connection? And it comes back to this fact that how social connection is defined really determines how it's measured. So the Vancouver Foundation conducted a connections and engagement survey, and they measured both the personal or individual connections, such as feeling alone, or the number of close friends in someone's community, in someone's neighborhood, as well as more neighborhood connections, like obstacles to getting to know people on your street or on your apartment floor. So as I was saying, measuring social connections really depends on the context. So this survey, they actually looked and asked the question, how often do you have a conversation with any of your neighbors? And twice as many people in high rises and apartments said they never chat with a neighbor compared to those in townhomes or detached homes. And double the number of renters said they never spoke with a neighbor compared to homeowners. So then we can start to ask why. And I think this also comes back to how we're designing high rises and buildings. And so we're going to talk about some best practices to increase social connections within these high rise and neighborhood and apartment neighborhood communities. And so I also want to contrast that with this example of measuring social connection at a broader level. So in Canmore in Alberta, they conducted a sense of community survey as part of their community monitoring program. And in 2008, 70% of responders indicated that Canmore has a strong sense of community. And this increased to 80% in 2013. In 2008, 93% said that they liked living in Canmore, which increased to 96% in 2013, which is quite an impressive number. And overall, there was really a strong sense of community with both permanent and non-permanent residents. And importantly, public amenities, such as pathways, parks, the recreation center, and at the time, the new elevation place, were all identified as key elements contributing to this sense of community. So recent research shows us that about 1 in 3 Canadians feel loneliness and social isolation. And social isolation is more about the frequency of connections, and loneliness was more about the quality of those connections. And this has actually increased to 33% in 2020 versus 23% in 2019 due to the pandemic. And importantly, people with low incomes, Indigenous peoples, people of color, LGBTQ+ groups, people with physical disabilities, and single Canadians were all disproportionately represented. And one recent study actually found that during COVID-19, socially cohesive neighborhoods experience less panic, depression, worry, and distress. And so from a policy standpoint, they noted that it's incredibly important not to fracture these existing networks and ties through, for example, snitch lines such as reporting on your neighbor. And so the importance of social connectedness is really being recognized and being taken up across Canada and internationally. But it is necessary to set aligned goals and targets that are measurable. And one example is the Healthy City Strategy in Vancouver that identified that one of the priority areas in the action plan was cultivating connections. And so here's an example of a very specific target, that all Vancouverites report that they have at least 4 people in their network they can rely on for support in times of need. And so here I think it's important, when we're always thinking about metrics and what we're tracking, that we do set goals to move towards, whether or not that happens within the 5 years or the 10-year plan, but I think it's important to keep pushing ourselves. So now that we know what we're working towards, let's take a look at some of the research, evidence, and best practices related to built form and design, but specifically how this influences social connectedness and inclusion. And I like to think of the evidence as the framing for this work. So if we think of sort of the internal structure of a building that really holds it all together. So this is the framework in the Healthy Built Environment Linkages Toolkit that I mentioned. And as this framework depicts, there are multiple components that really impact social connection. They're all interconnected and necessary, but I'm going to focus more on some of these areas today. So namely neighborhood design, natural environments, and housing. And these summarize the evidence specifically on social well-being as a health-related outcome. And this is one of their evidence diagrams. And so the bolded dark gray arrows show strong evidence. The dotted ones show emerging research areas or less strong evidence. So there is strong evidence for mixed land use, which contributes to increased walking and increased cycling, which in turn increase social well-being. And this is really an important element of a complete neighborhood, is that it's built at a walkable and bikeable human scale, and that it meets the needs of people of all ages and abilities. And there really should be, this should be part of a safe and convenient access strategy to the goods and services that we need in daily life. So this was a systematic review conducted by Mazunder and colleagues, and a systematic review really is the gold standard in research. And they identified specific aspects of the built environment that impact social capital. I hear someone unmuted. I'm going to keep going unless there's something I need to be aware of. And so these aspects really, this systematic review really included studies from around the world, such as United States and Australia. And unfortunately, they did note that there were methodological limitations and gaps in the literature, meaning we're not really evaluating and monitoring this as much as we could be. But they did publish this matrix, and of the articles that they included, they depicted the links between social capital and the built environment. And so if we look across the top of this table, there was somewhat of a negative relationship between density and social capital, but it was unclear. And so this doesn't mean that we shouldn't strive for density. And also I want to point out that some of these studies were in more rural communities. And so while social connection can absolutely still be fostered in rural communities, it looks very different than it does in high density urban areas. And we will look at some examples of how to create higher density neighborhoods well and improve existing neighborhoods. The design component referred to the fact that higher street connectivity was better compared to traditional suburban streets with cul-de-sacs for a sense of community. Sorry about that. And in relation to destination, this was actually the most important and significant relationship. And so really speaks to walkability around a neighborhood, but also to sites of interaction like libraries and cafes. And the diversity component refers to more land use mix and green space, which also has a positive relationship with social capital indicators. So really, as we can see here, density is a precursor to having nearby destinations, street connectivity, walkability, and cyclability. So they really do all work together. The Glasgow Center for Population Health had this quote that I thought was important for us to acknowledge. The density of the built environment can impact levels of trust and social capital, and lower density forms of development can actually stratify communities into distinct social class groups, which is not desirable. And so although we don't know what the quote unquote perfect mix of social groups in communities and neighborhoods may be, research does show us that no mix is not good. And here are some of these international best practices from Europe on how to create well-connected, higher density apartment neighborhoods. And pictured here is the refurbished apartment towers. It's a mid-rise infill housing project with upgraded open space in London in the UK. And so this document really highlights some key ideas to promote social connectedness. And one of them is to create common building areas to gather in, such as mailbox areas, and more innovative ideas like greenhouses on the ground floor. It's important to improve safety or even perceived safety through concierge services. An idea to combat stigma in existing neighborhoods is through murals and community street art, and intentionally design sites to gather outdoors, for example, spaces to host farmers markets and festivals. And these are some other best practices to support mixed use growth to create and foster complete neighborhoods within apartment tower neighborhoods. And so these images show a variety of projects in the UK and the Netherlands. And here what I want to point out is that having a range of design aesthetics with different types of housing typologies is key. And so this would include owner, rental, subsidized, rent geared to income options for a healthier socioeconomic mix, as well as if we start to think about low-rise, mid-rise, and high-rise forms within a neighborhood. And so mixed use infill and intensification strategies also involve integrating shops, services, and amenities. And high quality open space and consideration of the public realm is also key and is something that we're going to talk about later on in the conference as well. And so this was an initiative in Denmark that was a renewal of public housing estates. And so this is an example, if you can see some of the images here, of creating high quality open spaces. And this initiative has generally been evaluated positively. And so we can start to look to different ideas around the world to start to get ideas for how we can do that here in Canada. So this is a figure from Dr. Teresa Tam's report in Designing Healthy Living, and it highlights the neighborhood features that impact social support and community belonging, and specifically the pathways to positive health outcomes. So I want to point out two contextual pieces here. So the first is that there are mediating or intermediary factors that impact this relationship and can actually take away from social connection or social connectedness if not implemented properly. But what we do need is things like low crime, low noise, little trash and litter, few hazards, better safety, which is a complicated concept, and affordable housing. And two, the determinants of health, like age, gender, race, income, and education that Dr. Lee mentioned in her presentation a little while ago. And all of those really play a role along this whole pathway. So here are some specifics. To improve street design, we need connected streets, wide sidewalks that are well lit, houses that are close to the street with front porches and yards to facilitate interaction. We need to facilitate and support active transportation infrastructure. So that's walking, but also rolling with mobility devices, cycling infrastructure to nearby destinations. And so if we think about it, actually having separated bike lanes for safety, accessible and affordable public transit, and this is all facilitated through mixed land use and higher population density. And we also need to plan places where people gather, like libraries, community and recreation centers, restaurants, places of worship, and also incorporate public arts. And so hopefully by now, it's starting to become clear how all these pieces really work together. So streets are one of our most extensive and greatest public resources, and they have applications at the building, site, and neighborhood levels. And so the authors of this study noted that many policy and practice documents refer to the need for high quality of spaces, where quality is often left up to interpretation and is very highly variable. And so what they tried to do was to distill 12 attributes that impacted social capital. And so I've listed 5 here on the right side of the screen. And so, for instance, the need for clearly identifiable public spaces, which one might think is fairly straightforward or basic, but is actually quite important to note what is public space. Number 4 is streets that are attractive and safe to use both day and night, and continuous frontages with few blank walls were also found to be key. So here's a quote to think about. Planners should focus on addressing how the public wants to be social and provide spaces that help to develop a social lens. Let's talk about natural environments and green spaces. So the organization Park People did a national survey on COVID-19 in parks last year. And they conducted a public survey with over 1,600 residents across Canadian cities about their park use. And they also did a survey of municipalities with 51 Canadian cities. And so here you can see that mental health was found to be so important, but also that 40% of respondents said that parks have become more important to their sense of social connection. So while 38% of people who live with others said parks have become more important to their sense of social connection, this actually jumps to 47% for those who live alone. And 50% of cities in the survey indicated that they're already experiencing reductions in staffing levels for park maintenance and operations, and that this is a key challenge during COVID-19. And about 50% said that there are expected negative impacts on park budgets within the next year. And so perhaps this speaks to how there's a disconnect between what the public and what people are looking for and how we distribute some of our resources. And when it comes to the aspects of the natural environment and green spaces that impact social connectedness, quantity, quality, access, and accessibility are all important. So we need to protect natural environments and ensure that we have green spaces. And larger spaces are important. They definitely have more of a link, and in terms of how people can gather and have that sense of social connectedness. But also a well-connected network of smaller parks were found to actually also be beneficial to social inclusion and connectedness, if the paths encourage sort of things like recreational walking. And so this is important if we're thinking about new developments in neighborhoods, but also when we're thinking about retrofitting existing neighborhoods. And the quality of green spaces was found to be even more important than the quantity. And so this includes so many different components like outdoor recreation facilities, like basketball or tennis courts or ice skating rinks. Also things like the aesthetic surroundings, common spaces of cultural value, appropriate amenities and facilities while you're in the space, so things like washrooms and drinking fountains, as well as biodiversity. And these spaces need to be well maintained and perceived as safe for them to have that positive social impact, because otherwise they can actually do the opposite. We need to ensure access and accessibility. So for example, considering signage in Braille in multiple languages, thinking about ramps for physical accessibility, winter maintenance of public access routes or ravine access even, especially in a country like this where so many of our cities have winter for so many months of the year. And I often think about how we don't talk about white spaces, but really when these green spaces are covered in snow, it's not something that's unexpected. We know it's coming, and so let's plan for this. And studies have actually found that residents with less access to green space had a greater perception of loneliness, and that publicly accessible green space within a 500-meter buffer off your residence was linked to a higher sense of community belonging. So inequities are unfair differences that result in disparities between different groups, but they are avoidable. And they are linked back to the social determinants of health, but also systemic factors such as sexism, racism, homophobia, and transphobia, xenophobia, and so on. And so in a healthy and connected community, we want everyone to be able to reach those apples or reach those outcomes. And how can we do this? And importantly, cities and towns are influenced by these notions of who belongs where and who has access to what resources. And so in April of last year, I'm sure many of you are aware, but Christian Cooper, who is a bird watcher and a Black man, had the police falsely called on him while he was in a green space in New York. And we know that people of color, Indigenous and Black people in particular, face disproportionately higher levels of violence, harassment in public spaces. So on streets, in parks, on public transit, all as a result of systemic racism. And this is just one example. And when we don't actively address these within urban planning, design, and policy, we perpetuate these injustices and inequities and are complicit. And so focusing on those who have historically been left out and marginalized actually benefits the entire community with respect to social connectedness. So we can actually measure and track inequities at the neighborhood level. And this recent study, the authors used the data platform Keynote, the Canadian Urban Environmental Health Research Consortium, to measure specific neighborhood level factors and estimates of active living friendliness. So this included things like walkability and greenness within 3 cities, Toronto, Montreal, and Vancouver. And they measured the distribution across different neighborhoods and areas in these cities. And it really showed that environmental inequity is present. And they noted that there's potential for municipalities to refine investments and prioritize areas for interventions based on this data. So here's one of their diagrams from their study. And this is in Toronto, we can see the quote unquote sweet spot depicted by green triangles on the map. And the image shows that this area has large trees, which provide shade, sidewalks, there are houses close to the street. And in contrast, you can see with the red squares in the quote unquote sour spot, it's very clear that there are wide roads and the neighborhoods are quite car-centric. There are no sidewalks in this image. There's less street connectivity, which we can see in the bird's eye view. And it's likely not as safe to walk either. And there are no quote unquote eyes on the street here. And similarly in Vancouver, we can also see some of these stark differences in the built environment between the sweet and sour spots. And so this article highlights how initiatives like urban green space strategies may actually be quite paradoxical. So when we're trying to tackle environmental justice issues and do this through the creation of new urban green space strategies, this can actually make neighborhoods healthier and more aesthetically attractive, which we want. But then it can also increase housing costs and property values and potentially lead to gentrification and a displacement of the people the strategies were designed to benefit. And so this highlights that there's a fine balance of making a neighborhood just green enough. And I'm going to share an example from Regent Park in Toronto, where policies can be one strategy to protect local residents from gentrification, ensure they remain in their neighborhoods. And also, if we think about the example I shared on Denmark's urban restructuring projects, greening initiatives within existing developments can and should be done, It's just important to think about all the other social components and ways, the importance of keeping people in place. So let's take a look at just some of the interventions that can take place at the building, site, and neighborhood levels. So this is the Regent Park Revitalization Project in Toronto, and it's an interesting case study that touches on a lot of the concepts that we've discussed. And I'm just going to name a few of them. This neighborhood is located in East Downtown Toronto, and Regent Park was a social housing development community. And in 2003, City Council approved an approximately 25-year-long revitalization with 5 phases, which you can see depicted in the different colors on this map. And we're currently now, I think, in the middle of phase 3. So it's a complex project. There's a lot of research and information out there if you're interested. But once the Regent Park revitalization is complete, there'll be over 2,000 replacement rent geared to income units, about 399 new affordable rental units, and over 5,000 new market condominiums. And so there are several new amenities, such as a new aquatic center with a beautiful pool and a community green space right in the center there where the arrow is pointing. And there is mixed use planning with many different services, agency spaces, and retail options. And so there were a number of community considerations in the redevelopment. This image was taken in the center of that green space in the middle of the map. During some of the work I did while at the Wellesley Institute through a community walking visit of the green space in collaboration with community organizations. And so although there have been many positives to this redevelopment, there were several unintended consequences that I'd like to quickly highlight. So community members did identify issues with relocation during the revitalization process. And although there was a right to return system organized by Toronto Community Housing, it wasn't a perfect system. And also this process really impacted the existing social fabric of that neighborhood. And so it is important to have policies in place that intentionally protect against gentrification, pushing out previous long-term residents. The community repeatedly asked for a washroom in the park. And so when that didn't happen after extensive consultation, some of the residents felt that their requests weren't really being heard and that perhaps it was a little bit of a tokenistic process. And the aquatic center was so popular that people from outside the neighborhood started to come in, pushing out local residents, and there were barriers to them signing up. And up to 70% of the pool users for some of the public programs came from more affluent neighborhoods outside, creating an access issue. So places and neighborhoods can be built and designed to increase social interactions, promote health and well-being, and reduce social stress and social isolation, but they are not created equally. It is key to design accessible mixed-use neighborhoods with higher density, with spaces where people can gather. And so this is an image right across from the park that I showed you in Regent Park. It's Daniel Spectrum. It's an arts and cultural center in Regent Park. And it's actually connected to this Paintbox condominium, which you can see by Diamond Schmidt Architects rising up on the right. And so this is a wonderful space that hosts a range of activities and has co-working space. They have a community-run restaurant, which provides catering services and is overall just really strong community hub. And is a good example of how principles of mixed land use, higher density options can be implemented. And there's actually a streetcar and public transit route that goes right down the street in the foreground. And I think, again, if we're thinking about how this needs to be developed over time, in the image, there was no crosswalk right there. And so many people were jaywalking because it was the shortest access point to the building. They've since put a crosswalk in, but it really highlights how this is an iterative process to keep improving neighborhoods, and it requires resources and commitment by the different players involved. Commit to meaningful ongoing collaboration with communities. So on the opposite side of the aquatic center, there's a bake oven and a dog park, and these are some community garden planters. And one of the participants actually noted that the planters pictured here are too high up for children or people using mobility devices to actually use, which is ironic because they were originally supposed to be for people, for seniors or people with back issues who wouldn't have to crouch down during gardening activities. But now multiple other demographics can't really use them. And the image on the right was where we mapped some of the built environment features to identify what residents thought positively or negatively impacted their mental health and sense of well-being. And so really designing spaces requires understanding social interactions of different groups, because the nuances within a community can often be overlooked by those who don't fully understand it and who are outside the community. So this was the community organization that I partnered with for the walk. And Building Roads Together is a community-based peer support walking and rolling program. And one of the key components of success here was really that it was in partnership. It was planned, implemented, and evaluated in partnership with communities and peers, and they've published some of their work. And specifically aims to reduce social isolation and build shared leadership among people, newcomers, and people in Regent Park experiencing social exclusion. And the goal is now to plan scaling and evaluation of this innovative low-cost solution across cities. I wanted to highlight that we need to support community spaces that are tailored to the needs of the community and acknowledge cultural diversity and histories. And this is an example where a local community group in Toronto successfully went through all the city's proposals and processes to establish the first open-air tandoor oven in a public park in North America. And rather than just a bake oven, this was a public amenity that was tailored to the community, which is predominantly newcomers from the South Asian community. Another example I came across recently is how the Alberta Avenue Community League in Edmonton is working on turning an unnamed park into a memorial for missing and murdered Indigenous women and girls. And so they're working with Indigenous elders to decide on the name, and perhaps folks here in the audience know more about this initiative than I do, and there's still a long process to go and work through, the process and development approvals, but I think it highlights the importance of considering local history, stories, and contexts. This is a study in Vancouver that actually found that microscale features, such as benches, contributed positively to older adults' mobility experiences and specifically to social cohesion and social capital. And so they found that it's actually an immediate and inexpensive strategy to create supportive neighborhoods for people. And so maybe this is something that we can think about implementing across our cities. There are many equity layers to consider when it comes to, in particular, to age-friendly communities. My neighbor uses a walker now, and the uneven pavements in Toronto, especially in winter, are such a safety hazard. And for seniors, it is important to have evenly paved, wide, walkable, well-lit sidewalks and trails. And this really does allow for community participation and to reduce social isolation. And within these groups, there are those who are historically underserved. And so there are layers of equity issues. And when we improve the built environment for certain populations, it really does benefit everyone. We need to create affordable, safe, and permanent housing. COVID-19 has really exacerbated and highlighted the existing structural issues with housing. And I know I'm coming up to time here. So what I am going to say here is that many encampments have been set up in public spaces, and communities are responding with tactical urbanism initiatives. This is a low-cost temporary solution. The Toronto Tiny Shelters by Khalil Seavright, who's a carpenter in Toronto. But really what we need is new and improved strategies. And the housing crisis really is unfortunately the result of decades of policy design. So we need to think about rent geared to income housing and different affordable housing initiatives. And so there's always room for creativity. There are a number of existing creative ideas, and I think so much more that we can room for so much more. I'm just going to mention laneway housing, green roofs, and privately owned, publicly accessible spaces as some options that we could look into. And so here are some principles and considerations to take away. From a policy perspective, we need to embed objectives, goals, and strategies in official municipal plans, community plans, regional growth plans that focus on social connectedness. We need to create land development and mixed-use zoning policies as well. Planning should really implement some of these evidence-based strategies that we've discussed, and we need to keep building on these best practices. We need to pay attention to processes. So we need to have a meaningful and ongoing community collaboration that is not tokenistic. Consider the demographics of the community and provide culturally safe and relevant engagement opportunities. Oftentimes I've heard about, well, who gets to have the luxury or the privilege of participating and who has the time? We need resources to facilitate community engagement and actually compensate people for their time and expertise. We need to consider an equity lens at all stages of research, practice, and policy, and embed equity-based placemaking. Partnerships are so key. Local governments should partner and work closely with communities, organizations, schools, public health sectors, and for-profit sectors as well, with developers, firms, and residents. Support community programs, initiatives, and residents. And so with it through implementation as well, and where possible, offer municipal facilities and funding that encourage social connections. We need to embed research, so it's important to define and measure social connectedness over time and with specific groups who have been marginalized. And I thought this was a good quote from an article. The author stated that policymakers and program delivery staff should reach out to researchers in advance of implementing changes to the built environment to allow high quality pre-post studies of built environment interventions. To summarize, social connectedness is a key component of healthy cities and communities. There's growing awareness and urgency that we need to address this. To do so, we need to measure, track, and actively design for social connection at multiple scales and across sectors. And from a health equity perspective, spaces and neighborhoods need to be accessible, of good quality, and meet the needs of the people who use them. Most importantly, centering the experiences of those who are most marginalized. Dr. Karen Lee already mentioned that some of these documents will be coming out, but I'm really excited to have a look at them. So the Healthy Community Guidelines by Housing for Health includes a social connections component and identifies specific built environment strategies. The new BC CDC toolkit includes social and cultural factors and provides a framework for this. And exciting to see that the City of Edmonton city plan identifies a healthier city as one of the 4 pillars. And this is really something that many municipalities are taking on and seeing the urgency and importance of. Thank you very much.